Our next topic is about safe and comprehensive perioperative nursing care. For the introduction, the term perioperative nursing this encompasses the preoperative, intraoperative, and post-operative phases of the patient's surgical experience. For assessment and care during the perioperative period, first is identification of patient with two identifiers such as name and date of birth, mental and physiological status of patient, functional status such as patient ability to perform ADLs, activity of daily living, cardiovascular and respiratory status, skin condition, nutritional status, for example, for how long has the patient been NPO, range of motion and mobility, pain, any prosthetics or corrective devices, sensory impairment, language barrier, cultural or spiritual needs, and anxiety for previous surgery and anesthesia experience, and also for allergies, and assess also for medications, herbs, nutritional supplement, and drug abuse. And then for techniques in assessing the surgical team during the operation, first is assess the surgeon in donning their sterile gloves, assess in moving the back table, the ring stand, and the Mayo stand into position. At this point, the sterile field has been established and the circulatory must be entered this sterile field. Next is connect the suction machine and adjust the light. Connect and adjust the portable light if it's to be used for additional illumination of operative site. Next is place the kick buckets in position convenient for their use, one of each side of the operating table, and connect the electrosurgical electrode cord or any other electrical equipment to be used, and place foot pedals within AC reach of surgeon's foot if they are required, and place the straight tools or the other type of stools into position if they are to be used. And last is during all this procedure, the circulatory must be aware of practice aseptic techniques. The circulator must be alert for any breaks in aseptic techniques by any member of the operating team and take appropriate action if a break occurs. And then for principle of safety, comfort, and privacy during the perioperative period, appropriately comprehensive information about the patient health status should be documented prior to planned procedure. Next, the patient should be assessed to be in their best reasonably achievable health status prior to a planned procedure, and information about the patient should be readily available to any health professional caring for patient to enable appropriate clinical decision making, and the patient should have appropriate understanding of the rationale for the planned procedure, the expected benefits, and the alternative treatment available, and the risk of having the procedure and associated care. And the plan of care for procedure should be determined by a process that integrates requirements arising from procedure-specific issues, patient health issues, the patient personal preference, and the requirements of the system or hospital. The next is the plan of care should be documented either as in accordance with predetermined routine management for the procedure, or where relevant are the variance from usual process as separate aspects of planned care. And person caring for the patient should know of the requisite observation, that must be performed to be identify possible adverse outcomes and be able to respond appropriately to unexpected outcomes. And for the last is at all times there should be a clearly understood hierarchy of responsibility for decision making regarding any aspect of care for the patient.
So, for the nursing responsibilities during the perioperative period, so perioperative nurses use a comprehensive multidisciplinary approach to patient care, assisting surgeons and surgical teams to care for a patient before, during, and after surgery. So, specifically, responsibilities and duties of perioperative nurse include working with patients prior to surgery to complete paperwork and help answer questions or calm fears about surgery. And then, monitoring a patient's condition during and after surgery, and selecting and passing instruments and supplies to the surgeon during operation, sometimes referred to as a scrub nurse, and then managing the overall nursing care in the operating room to help maintain a safe and comfortable environment, sometimes referred to as circulating nurses, and educating the patients on best practices for recovery, including pain management and keeping one's clean, and also cleaning surgical equipment and operating rooms to maintain a sterile environment. So for the preoperative physical, psychological, spiritual preparation, so we have first the physical responsibilities. We have to provide for physical safety, prevent complication, alleviate pain, and also to facilitate recovery process. For the psychological responsibilities, explore the client's fears, worries, and concerns. Encourage patients' verbalization of feelings. Provide information that helps to allay fears and concern of the patients and also give empathetic support. So for the continuation for the spiritual responsibilities, help patients obtain spiritual help if he or she requests it, respect and support the beliefs of each patient, as if the patient's spiritual advisor knows about the impending surgery. When assessing pain, remember that some cultural groups are unaccustomed to expressing feelings openly. Individuals from some cultural groups may not make direct contact with others. This lack of eye contact is not avoidance or a lack of interest but a sign of respect. Listen carefully to patients, especially when obtaining the history. Correct use of communication and interviewing skills can help the nurse acquire invaluable information and insight. Remain unhurried, understanding, and caring. So,
Good day, everybody. So, I am Joshua Go, assigned to the task to report about the 1.2 and 1.3 as continuation part of the nursing care, the intraoperative or the purpose and function of the circulating nurse and the scrub nurse. So, since we all know what is circulating nurse and scrub nurse, to begin with, these are also called them the operating room nurse, di ba? Since we all know naman ang surgery, kung ano ang surgery. So, an operating nurse, it is a special type of a practicing nurse, or pretty, you can call it student, or the practicing nurse, or the nurse practitioner, which specially trained and to handle the fast-passing environment with accuracy while maintaining a professional approach towards the patient care. These nurses are packed with a complete existence in all comers of the OR. No, their knowledge and skills, which make them constantly challenged depending on the demands of the procedure and their surgical teammates together with a doctor, anesthesiologist, and others, and so on. So there are two types of a nurse with they are applying theories on extreme physical exertion, no, which prolonged standing or during the operation. There are two types of nurses with us. We all know this: the circulating and the scrub or the assistance of the surgeon. Also with a mixture of the presence of mind and the ultimate weapon in their day-to-day performance. Above all, they are all masters of application in the OR techniques, like the holistic approach in a sterile environment or non-sterile for the circulating, where the reason why the most healthcare facilities recognize them as the superior nurses with their institution or in the hospital. To begin with, we have the scrub nurse or a circulating nurse. So for the scrub nurse, what is a scrub nurse? This is also known as the sterile nurse, no, or the instrument nurse or the assist nurse. So these nurses are because he or she because nurse can be male and female, performs a multiple tasks during the operations and the procedure. They are completely responsible in the maintenance of the sterility of the sterile area and materials. They can also have the direct access in the immediate surroundings of the operative site. And then for the circulating nurse naman, ang circulating nurse on the other hand is also called the unsterile nurse or the facilitating nurse. You can call this them. Now they are called either above the mentioned names because they are facilitators of the sterility but not actually during the conduction of the OR, operation procedure. They play an important role away from the sterile and surgical team and operative site by providing necessary help and giving the materials and equipment which cannot be across by if you do that you become unsterile. So across in the sterile team. So the function and purpose of the nurses before the operation. So before the operation, right after the client arrives at the OR or the lobby, when the nurse give the patient to the operating room, function of the OR nurse starts. So this is how it starts. By this time, both of the scrub and the circio may not be performed the same task, but this is the most time in nature. So from the time of arrival to the time of incision, and either of the nurses, both them can perform their activities. So receive the endorsement from the client, the chart and supplies and so on, and note the time, the counter, the check of the patient, identify the procedure, the operation to be done, recheck the operating schedule or the checklist, complete the carry out, review the laboratory for any significant impact on the operation, recheck the consent form, the completeness, remind and check the schedule of the patient or the surgeon or the members of the team for availability of repairs, the OR, the table, the bed, the materials, the equipment, the machine, ensures the function and everything to be used, and then performs the emergency kit, reinforce knowledge to what expect during the operation. So for the scrub nurse, before the surgery happens. After this time, the scrub nurse can now perform the surgical hand washing, gowning, gloving. We all know that one. The strict adherence of the OR technique. She can now serve the gloves and sterile materials to the surgeon and other members of the sterile team. Also, she can now prepare the sterile materials and equipment on the Mayo table because that's all are sterile. And then arrange the comfortable facilities speedy of the performance. And then he or she may not start the initial tentative counting of the sponges, needles, sharps, and other tiny materials that will be used in the procedure. And then for the circuit naman before the surgery, as the scrub nurse moves to perform his or her role, circulating nurse will continue handling the client by establishing the check of vital signs since unsterile naman siya, and then check the administration, the time, the dosage, by whom the effects of the anesthesia, partners ng anesthesiologist, ensure safety while transporting a patient from the lobby onto the OR table or to the bed, assess the position of the client, induction of the anesthesia, assist siya lahat doon. Note the time of induction, assist the positioning of the client, and the desired position of the OR or the procedure, and then place the straps, restraints, and other protective materials for safety of the patient. And then also assist in dressing, gowning of the sterile nurse, in the back part only, the unsterile part. Calls for another request and corrections among surgical team members, and then also they prepare the additional materials when accessible areas na unsterile lang. And then during the operation naman, right after the surgical scrubbing of the sterile nurse or na-scrub na sila, circulating nurse begins dito na yung work niya. The scrub nurse will focus on his or her attention performance of the role sa sa part ng scrub nurse. The taking care of the sterile field naman siya, materials and other sterile team members on the other hand. And then the circulating nurse focus on the relevant activities and other distant on the sterile field. So, ang purpose ng scrubbing nurse, ang assemble siya ng mga table, pinag ko na itong table, maintain the sterility, and then charge the parts or instruments sa mga doctors, mga example, knife, mga scalpel, serves the additional nga mga antiseptics nga further cleanse incision site, depende sa doctor's order, serves the serial dropping materials like towels, clips, eye sheets, and others, then also serves the knife with scalpel, type of tissue until the end of the operation. Also kanang mga sponges na dapat kanang particle ng gagmay nga materials, iaano niyan kasi baka pag nabili niyan sa sulod pwedeng mag-cause ng other dapat ganun. Dapat very keen ang scrub nurse during the operation to ha. And then anticipate the materials needed to be used next. And then also like contraction, precisioning of the materials, ang nurse niya magagawa niyan. Mag-assist lang siya sa surgeon while doing the procedure. And then monitor the number of materials need kaya kung gayon na kay baka maiwan kasi doon sa pwede mag-cause ng problem yon. Now, serves the materials, suturing materials, ka mag-prepare ng mga needles, ganon, notes the closing time, o isusot mo ikaw, anong oras na sinirado yung patient, for example. Collects the instrument and materials and equipment, which is the body, kaya baka maiwan din sometimes yung mga materials. Because some doctors may forget nga meron pa palang maliit na needle doon na iwan niya, or scissors ba na inside nga, igibilin sa kadali, for example, because na pa siya other na part. So, dapat very keen ka and you know that one. So during the operation, ang circuit ay ang kanyang buhato naman is records the time or sugod na tayo ganon. Anticipate also the serving the additional materials, yung mga mga liquids, you know that na-demo na to natin, di ba? No, yan ang mga purpose ng and then assist the anesthesiologist pag mga unsterile ba sila dalawa. And then maintains the communication among the surgical teams, no? And then like laboratory, surgical ward or other na mga and then continuously monitor the drop materials and document yung mga nilalaglag kasi merong pag pinasok ang nurse ang scrub, then yung nilaglag na materials yun ang ng circuit, ikaw magka-count nun. So that's the documentation and everything done happen during the operation. But chronological order yun siya. Then assist in counting the sponges and needles, blades na yung mga kasi dapat alam din ng circuit yun kasi kayong dalawa ng partner mo ng scrub nurse na basi nakalimot din ang i-remind mo rin siya, no? And then note the time of the closure also, and then assist the transferring of the client from the or papunta sa PACU, yung post-operative kasi sasakit na yung patient pag after mga pila ka hours, mawawala na yung power ng anesthesia, so magpipain na ang patient. So after the operation naman, after the closure or finish na ang surgery, scrub and circulating nurse will gradually meet the common point. They will both focus on concept of aftercare sa mga materials. So ang materials ng scrub nurse na kanyang lilinisin, contribution to the aftercare, ang mga materials, yung mga scissors, siya maghuhugas nun. Yung mga secretions, mga fluids na mga sa sterile, nasa table, that's the purpose of scrub nurse. Together with putting the machines back in place, magliligpit nun, kasi siya ang nakaalam nun. And then mga sterilization items, mag-assist lang yung circulating nurse sa kanya. And then bago nila endorse sa PACU. And then after the role performance, they will go back to vacated operating room and finally check the arrangement of every details, returning it back to the original places and keeping ready to catheter for the next operation. And then also, they presented the roles of OR nurses, whether scrub or circulating ka, realistic and can be appreciated here in the Philippine setting. But kaya gusto ng mga taga-ibang bansa yung mga nurses in the Filipinos because they are very careful and very mabait and then very caring kasi sa ibang hospital sa ibang bansa pag tapos na yung time ng shift nimo, so you did not care for the aftercare of the materials kasi tapos na yung oras mo, hindi ka na binayaran. Only in the Philippines yung mag-extend ng help or mag-extend ng kanilang time and effort, no, depending on the demand of the operation or the procedure. Okay, and then that will be all, and then we have down the next. And then for the second part, which is the 1.3 or the post-operative airway, na after the surgery happen, we have the 1.3, the airway, breathing, and circulation kasi baka mag-complications yung mga patient after they have the surgery, no? So dapat continue pa rin yung nursing care natin. In the other, for example, I'm not bias here, pero in the United States, after kasi pagtapos na yung shift nila, hindi na sila nag-i-extend ng time and effort nila in taking care of the patient. So that's why here in the Philippines kasi ganon, No, dapat ano. So your purpose and functions after the surgery or the intervention is the post anesthesia kasi sasakit na yung patient, the pain management there, no? Kasi mawawala yung anesthesia, mafe-feela ng patient yung pain and mawawala na yung manhid. So the post anesthesia nurse risk for complications and be prepared to implement the intervention should be changed in the patient's status. Nursing intervention include like mortal vital signs kasi yung sabi ko nga baka mag-change, baka may bleeding pa pala siya inside, yung mga materials na iwan, airway, patency, and neurologic status kasi baka hindi siya na-conscious na after the surgery, for example brain surgery, so baka hindi bumalik yung normal physiologic function of the human body. So nursing interventions managing the pain also kasi nga sabi ko sasakit siya pagkatapos ng surgery, mawawala na yung bisa ng anesthesia. Assessing the surgical site like assessing and maintaining fluid and electrolyte balance. Alam na natin yung electrolyte imbalance, we discussed that already in our electro. And then providing through a report of the patient status, receiving the nurses unit as well as the patient's family. Siyempre dapat we hit the extent of the the significant others. So what is PACU or the post anesthesia care unit? Ito yung stable na siya and free from the symptoms of complication or the surgery. Tapos na yung surgery ng patient. In order to transfer from PACU to the clinical, pauwi na yung patient, pa-discharge na siya, no? However, for developing complications, dapat kailangan continuous pa rin yung care natin. Baka tapos na surgery, pauwiin mo na siya. Tapos nag-bleeding pala siya inside, then malaking problema yun sa dapat ini-check. No, potential for developing complication. So immediate post-operative phase ongoing nursing assessment is essential on the post-operative, no? In this video, we will focus the immediate post-operative care in the PACU. So, kasi nga, pag pinauwi mo na siya, na wala pang care, hindi mo pa na-absorb siya pang pila ka days, baka, kasi hindi pala, gumaling, hindi pala maayo yung procedure ng surgeon, no? So, dapat monitor din natin yan. So, it should be located near the OR pagkatapos lang siya ng, or divided into 2 individual patient care spaces. Usually, 1.5 to 2 patients na siya, nakadivide lang sila sa OR pagkatapos ng surgery. No, each patient is supplied with a blood pressure monitor kasi nga itong monitor natin cardiac kasi baka mag-shock siya or baka mag-cardiac arrest. So, pulse oximeter, oxygen, airway management equipment and suction. Emergency dapat diretso ka para CPR mo siya or yung care na gagawin mo sa kanya pag nag-code blue ang patient. No, the length and stay in the PACU is determined for the basis that is not mandated minimum stay requirement. Di naman sa Amerika kasi pinapabayaan nila after kasi kuan. Pero pag critically patient talaga na do not recover at the same time, depende kasi sa patient yun eh. No, registered nurses in the PACU or RN, no, dapat maalam ka rin sa mga pagkatapos ng mga side effects ng anesthesia, side effects ng procedure, pain management, and other potential complications. There are 3 types of stages of post-anesthesia care. Number 1, for the phase 1, immediate post-anesthesia period when patient is emerging from anesthesia and requires 1-by-1 care. Dapat isa-isa talaga to. No, i-check mo talaga siyang care niya for the level of the consciousness, breath sounds, no, breathing, na circulation respiratory effort, oxygen saturation, blood pressure, cardiac rhythm, and muscle strength. The patient is being prepared to transfer from phase 1 to phase 2 or the ICU na siya after niya ng For the phase 2 naman, continue na siya yung recovery of the patients, conscious return from baseline, and patient now is stable from wala na siyang mga sa heart niya, and renal functioning may be okay na. Many patients bypass phase 1 and go directly to OR in phase 2 and the process known as the fast tracking. Mabilis ang check-up lang to, no? The patient as moves to phase 3 or home na siya to the care facility. Ang phase 3 naman, wala na ang problema and complications, ongoing care pa rin sa patients, needing extended observation lang siya, pero pwede na siyang puta sa ward such as 23-hour nga observation nimo and then hospital unit nursing care continues until the patient completely recovers from anesthesia and surgery and is ready for self-care o okay na, makalakaw na siya kasi wala na yung anesthesia talaga nito after 24 hours, 23 hours yun. And then also as a nurse, we're going to check for the pain assessment kasi nga sabi ko, sasakit na yung site ng surgery kasi wala na ang anesthesia. So, the nurse will receive a detailed verbal report from the circulating nurse and for anesthesiologist. No, yung nag-care ng nurse nito. Dapat na siya nga, pain recovery ng patient, no? The nurse performs immediate assessment of the patient's airway, respiratory and circulatory status, and then focus on more throughout the assessment. Immediate post-anesthesia nursing care, which is the phase 1. maintaining the ventilation and circulation, monitor the oxygen level, consciousness, and preventing from shock. Baka mag-shock, mag-code blue. And managing the pain. These nurses should assess the document the respiratory, circulatory, and neurologic functions. So, neurologic functions naman, check mo yung utak ng patient. Yung function niya, conscious ba siya after the surgery, no? Response to verbal stimuli, like pupils, responsiveness, light accommodations, ability to move all extremities, and strength and equality to hand grip, level of consciousness, assessment, such as the mga scale, Glasgow scale, mga ganon, no? Mga pain scale, after that, mga yung conscious niya, verbal, whatever that one. Okay? And then also check mo for laboratory, mga EBG niya, mga chest x-ray, baka may complications kasi siya after niyan. Wala rin, and then mga edema, laryngeal spasm, bronchial trachea symptoms, gurgling sounds, wheezing, shudder, distractions, and hypoxemia, pagkat niya mga complications na to. Nga anong mga complications ang makukuha ng mga patients after the surgery. The treatment like administer ka ng oxygen kung di siya makahinga, secretions niya, draw thrust maneuver, no? Sa CPR to, mga draw thrust kung nasal area, dapat i-check mo siya kasi sabi ko nga baka mag-code blue kasi baka may complications, may bleeding sa after the surgery, na stress siya or whatever that one, no? I-check mo kung may obstruction sa larynx, and then effects of anesthesia, kung ano, kamusta ka ma'am, sir, hypoxemia, baka mag-low blood siya, malipong siya, di pa siya makatayo, monitor the apnea, dyspnea sa heart niya, and oxygen. And then, we have also hypoxemia, no, common complication talaga itong hypoxemia, na wala ng oxygen. So, less than gamay na ang iyang oxygen saturation, 90, no, PO2 less than 60 mg per ABG niya. May result to hindi siya makahinga, mag-hyperventilate ang patient. So, anong gagawin mo dyan? No? You give opioids pag ma-hyperventilates, no? Kasi mahapin yan siya. Insufficient reversal neuromuscular blocking agents ng mga tambals, increase tissue resistance, decrease the lung chest wall compliance, baka mag-pneumonia siya, no? Obesity or gastric and abdominal distension, incision site close to the diaphragm, constructive dressing, post-operative pain. And then baka mag-aspirate din siya, by sabi aspiration, is when ka nang mag-gastric niya, mabalik mo sa lungs na mag-aspirate, baka mag-cause ng pneumonia, no? Mag-regurgitate manggod siya. However, that the blood may result from trauma or surgical manipulation, no? To check natin yan siya. Check for the risk of aspiration. Baka makikisok na siya infection. And then laryngeal spasm, to check mo yung laryngeal spasm niyan. Another respiratory condition na siya nga ang muscle ganun dito tissue causes complete partial closure of the vocal cords. Hindi siya kapagsalita after the surgery. Resulting the airway block, hindi siya makahinga. So pag hindi na-treat yan, na mag-hypoxia ang mga patient, brain damage, death, no? Especially the death talaga. So, check mo yung Glasgow yung mga sounds niya, mga dyspnea, crawling sound, hypoxia, hypercapnia, check mo lahat yon. So, ang dami ng mga nursing responsibilities natin, no? Medication also para reduce ang swelling sa larynx niya, no? Muscle resistance needed kung bibigyan mo siya and then doctors. And then maintaining the circulation, no? Dapat yung circulation niya, cardiac continuous yung heart and blood circulation after the surgery. Priority talaga yung breathing and circulation sa nurses. No, commonly encountered by cardiovascular complications, hypotension, hypertension, baka naman magsaka ang dugo niya. So, check mo rin yan, cardiac dysmerithias, niya, no, anesthetic agents, yung, kasi side effects ng gamot yun eh. No, check mo lahat yan. Pag nasa PACU ka, hypotension, mga heart rate, systolic pressure niya, dapat 90 or less na, mag-decrease pa yan. Confusion, restlessness of the patients, no? Mga common talaga yung hypotension after the surgery. No, fluid replacement ka kaagad, give ka ng IV if you are the PACU nurse. And then hypertension, balik-balik na siya, no? Accident, mga pulmonary edema, heart failure, no? Myocardial ischemia, and other mga complication. Hypercapnia po. Mababasa nyo naman kung anong mga complications ang pwede nilang makuha. And then cardiac dysmerithias, nga iba yung nurse, no? Kasi yung sa heart yan, bradycardia, supraventricular oxygen. So pag nurse ka dyan sa PACU, check mo yung airway niya kasi mga adequate ventilation, administer medication, no, oxygen as needed, especially talaga yan, oxygen. And then also monitor the patient's continuous lang yun, ay mga temperature, no, ato na ni kuan nila mga kuan niya, dapat ganun talaga yung mga, kasi magsasign siya ng acoustic yun, baka matigas yung mata niya, mag-acoustic ang kanyang mga eyes, mga oxygen, hindi kaya nung demand ng oxygen, no. And then hyperthemia, yung oxygen na maubos po diyang yung body temperature niya, sa check mo yan kay after 24 to 72 hours pag hindi yan na-treat na. Fluids loss, so fluid electrolytes imbalance natin dyan, no? Ato nang ipang check din atong mga fluids, give ka ng mga kuan ng IV yan after 24 to 48 hours, no? 1,500 ml para ma-stabilize lang ang kuan. Sabi nga tambo. Ayan, after the anesthesia. Nausea and vomiting also, common sign yung mga nausea and vomiting. Kasi nag-fluid electrolyte imbalance na siya after 24 hours after the patient. No, pain also is common. One of the assessment that one of pain. Kasi magsasakit na siya after the And then other important assessments, dapat check mo yung mga site kasi magsanya ka baka nag-dry ang wounds, proper draining and the drainage of the tubes, rate the patency of the IV fluids, kung nakakonect ba talaga lahat yan, level of sensation after regional anesthesia, circulation, sensation of extremities after orthopedic or vascular surgery. And then during the patient in the PACU, check mo yung mga intervention nimo na mga patient na siya katong mga scoring nimo, mga oxygen, no? And then go home na siya, discharge na kung okay na siya lahat dun sa mga complications, no? The patient's anesthesiologist will often discharges, paki-screenshot na lang yung mga yung picture niya lang yung kung mga main kinalang yung kinuha ko lang yung main nga kasi masyado na siyang mahaba, no? Kasi marami kang gagawin sa patient talaga. The anesthesiologist now will discharge the patient. Depende na sa doctor to. Phase 1, Phase 2. Pag Phase 3 na siya, pag okay na yung consciousness niya, may local regional anesthesia na siya, na wala na yung pain talaga, completely na siya. No nga, okay na yung pero minsan may mga side effects yun, like namamanhid yung part na yun. No, when the patient moves the patient into a short stay unit, they are third phase of post-anesthesia and now going to post-operative care and going home na ang patient. That will be all. Thank you so much.
So for meeting the physical, psychological, and spiritual needs of the clients, so first we have the physical. So for the physical needs, oral and mouth care to make the person comfortable if they are not drinking well. For the nutrition, to monitor basic nutritional needs even if the patient is not eating very much. Hygiene, for comfort and dignity. Pain relief, this can be given in a variety of ways even if the person is unable to take tablets. Drugs can be given liquid form as skin patches, via injection, or intravenously using a syringe pump to give continual pain relief. Also, bowel and bladder care. If the person is taking high levels of pain medication, they will be likely to develop constipation. Treatments and medication can be given for comfort. In some instances, they may develop bladder retention when the patient cannot pass urine and would require a catheter. And then, positioning. So, positioning, this is for comfort and to allow the patient or the person to be active if they are able, but to rest when they cannot participate. Skin can break down if the person is bedridden for long periods and they may require a special mattress on their bed. So for the psychological needs, take time to get to know them and understand the patient's feelings and experiences. This can be challenging if you're working shift patterns or do not see the same patients regularly, but even small gestures might help you get to know the patients better. And also encourage them to talk about their fears and worries in a calm, private, and safe environment. Listening actively without judgment is important for the patients to feel safe and heard. And then acknowledge how they are feeling and find out how they prefer to be supported emotionally. Some patients prefer a more upbeat approach, while others may want you to just be there and listen. Do not try to fix their emotional problems. Asking open questions and allowing the patients to talk about how they are feeling is likely to be more helpful. Help them relax by enabling them to do activities they enjoy, like listening to music or looking at photos. When they are relaxed, they might find it easier to talk about their emotions. Offer a hug or hold their hand. If it's appropriate, they consent. This can help them to feel safe and supported. Also, be prepared that they might cry. Crying is a common emotional response and sometimes an expression of emotional distress. You might feel unprepared, especially if someone cries suddenly, but do not feel pressured to say the right thing. Just being there and with the patient can help them. Showing empathy and offering physical touch like the above and offering a chance to talk are good ways to support a patient that's crying. Also, encouraging them to think about how they want to be cared for. This may help them feel more in control and help others understand what's important to them. So for the spiritual needs, take your take your cues from the patients. So since patients are guests in our hospitals, it's important to let them lead in every visit. Don't try to bring up topics about church or religion. Instead, start by asking how they are and what brought them into the hospital. This gives them the opportunity to share what's important to them. Also, demonstrate a Christ like attitude. So, love your patients the way God's love you. Don't just say you love someone, but truly love them and see the good in them. The means treating them like that means treating them like the person who is most dear to your heart, even if you disagree with with what they say or how they treat you. Ask the patients how you can support them spiritually. One of the easiest ways to provide spiritual care is to simply ask patients how you can support them and then do your best to follow through on the request. Support patients within their own faith traditions. So the point of providing spiritual care is not to convert patients to your religion. It's to connect them with the divine if they want it. Also, listen to fears and concerns without going into your own stuff. When someone starts sharing their concerns with you, it's easy to say, I know how you feel, and then launch into a story about one of your own experiences. Remember, though, that you are there to care for the patient and not the other way around. Then, ask if you can pray with them. Sometimes caregivers are unsure how or when to ask patients if they'd like prayer. For instance, if your patient is in distress, definitely ask if you can pray for them. And then the last one is share an encouraging the word. So scriptures has an amazing ways of uplifting spirits and encouraging people. One of the Bible verses that we can share to the patient is like for instance Psalms 46 verse 10. It says, be still and know that I am God. So that's all. Thank you.